So hello guys, in this short video I'm going to talk a tiny bit about work experience and volunteering and why those two things are very important for you when you apply to medical school. When applying to medical school, admissions tutors expect that you have a sound understanding of what an eventual medical career will be like. The best way you can gain such experience and such knowledge is by attending work experience placements and by having voluntary experience. So let's start with work experience. So what does work experience involve? It often involves shadowing a leading professional in that discipline, whether that's a consultant or a group leader in a research laboratory, and you often spend 1 or 2 weeks in that certain department learning everything there is about that. Now, work experience can be subdivided into 5 different subcategories. The first one is surgical placements, second one is general practice placements, third one is general hospital placements, whether that's in a respiratory ward, a renal ward, or a neurology ward. The fourth one is an accident and emergency placement, and the fifth one is a research laboratory placement. Now, from each of these different types of work experience, you'll gain and experience different things. You'll see medical careers in different perspectives. It will kind of give you a good idea of the variety offered by a medical degree after graduating. You know, you can pretty much go into whatever sort of discipline interests you. And so, in my opinion, it's really important to have, if possible, all 5 of these different placements. Now, it is difficult to organise all 5 of them because, you know, there are so many aspiring medical students, and so hospitals will be oversubscribed. So the best thing to do would be to aim to have 3 or 4 out of those 5 and organise those over 2 years. After my GCSEs, I had a respiratory ward placement and an accident and emergency placement, and after my AS levels, when I was a bit older, I was able to see more surgery, and I had a neurosurgery and a gastrointestinal surgery placement. Now, I understand that organising work experience placements, especially 4 out of 5 or 3 out of 5 on that list, is really difficult. But here is my advice on how to go about it. Firstly, contact your school careers advisor and ask if they have any contacts from past years. Now, do be aware that most students from the school will do this, and so often the doctors linked through the school or surgeons or researchers linked through the school may not be able to offer everyone placements. The best thing that I would recommend is go to your local surgery or local hospital directory. Now, every single hospital has a list of all the doctors that work there. Choose about 10 different doctors or surgeons that you find interesting, and often they have an email address or the email or phone number of their secretary. Now get in touch, and I would suggest that you read the short bio of each physician or surgeon you're contacting, and in the email, of course, as well as your CV, just mention your interest in their field of work. So if it's neurosurgery, look a bit about what that surgeon is specifically interested in, and just mention that in the email and say how that interests you, and kind of link in things that you've done to kind of show that you're interested in that sort of discipline. You may have read a book, you may have been to a lecture. Just mention that in the email, and that will make you seem more convincing to the secretary or to the surgeon that will eventually be sorting out your placement. Now, if you do this, you're very likely to get a placement, because a hospital may have hundreds of doctors, and not all of these doctors or surgeons will have work experience placement students. Now, of course, some may not want to take on any students, but most of them are really friendly and they'll be more than happy to sort something out. Often, once you contact a surgeon or a doctor or a physician, whatever, they will put you on to the human resources team who will finalise the placement and secure everything. I would suggest that when you do approach a medical professional, be flexible. You're trying to get the work experience placement, they have what you want, you're trying to get something, so be as flexible as you can with dates, and be as nice as you can. Try not to be demanding, because then, if you come across as being a bit arrogant or a bit rude, it's not for the best of things. Just be humble and see if you can get a few placements. With GP surgeries, it is more difficult, and I know that surgeries or general practices often say, due to confidentiality, which is really important, we can't allow you to go to your local GP because you might recognise patients from their records. So GP placements aren't really important. They are really interesting to have. I personally did not have a GP placement. I couldn't get any. But if you do have access to it, whether it's through friends, family, or through actually a surgery or practice, go for it. Now, research, I think, is really important as well. So often hospitals have a research department. whether it's a microbiology research department or whether it's a cancer research department. So often, you can look up group leaders of research laboratories at your local hospital. Again, contact them. Find something that's interesting to you. I'd really recommend that you go for things that you find interesting. Don't go for things that sound interesting or sound amazing. If you really are interested about it, just express that interest in the email, and of course attach your CV containing your GCSE grades and all of that. And fingers crossed you'll get the placement. Ideally, work experience placement should last a week or two, no more than that, because if you think about it, within 3 or 4 days you'll kind of have experienced and gained the most that you can at your position. Maybe once you're older, for example, if you're a first-year doctor or a second-year doctor, spending 6 months in a ward, you'll gain a lot more, and you'll learn and retain a lot more than you would if you're a sixth form student spending that sort of time in a department. So, just to repeat, a week or two is more than enough. And as I mentioned, you'd rather have more variety than have an increased length of work experience placements. So just about work experience, I just want to quickly talk about the different perspectives that I noticed from different placements. So when I was on my surgical placement, I often noticed that a surgeon would come in really early in the morning, 8 o'clock. So 8 or 9, they'd have the MDT meeting. MDT means multidisciplinary team, which involves all of the professionals in the department coming together. So that's surgeons, physicians, researchers, radiologists, anaesthetists, nurses, everyone coming in and talking about patients and what the best sort of treatment plan would be for patients. They talk about patients who came in overnight, but also patients who are due for surgery. As soon as that MDT meeting is over, the surgeon would often, with his registrar, often go around the surgical ward, quickly talk to patients who are awaiting surgery for that day, but also patients who had surgery the day before, just to make sure they're getting on all right and are comfortable with everything. The surgeon would then go straight into the surgical theatre and would spend quite some hours in there seeing or performing surgery on many people. Depending on the department you're in, the time of surgery may differ. I remember when I was in neurosurgery, some surgeries would take 3-4 hours. However, when I was in colorectal surgery, the removal of a gallbladder took half an hour, not even that. So I guess with different with different surgical lengths, you get to see how surgeons go about managing those sorts of workloads. Having to concentrate for 3-4 hours non-stop is very, very tiring. But also having to perform surgery on many different patients, even though they're small, short surgeries, having to perform many of them has another different aspect to it. So these sorts of things you can see when you have different surgical placements. So after performing surgery in the afternoon, often surgeons would go to clinic. So what is clinic? Clinic is where patients who've had surgery performed by that surgeon, or patients who are awaiting surgery or want to discuss surgery come in to see the surgeon. It's often a one-to-one meeting with the patient and with the surgeon, and in this meeting they discuss any concerns that have arisen. After clinic, often a surgeon may either go back to surgery, or if it's 6 o'clock, 7 o'clock, the surgeon may go home. So that's the typical day of a surgeon. Sometimes surgeons may go to give lectures to medical students, or they may teach registrars. They have a variety of different roles. Now, when I was on a respiratory ward, it was very different, because of course every morning did start with an MDT meeting at 8 o'clock, but then instead of surgery, the consultant would spend a good 2-3 hours on a ward round, because often he had 20-30 patients. So they'd go around to each patient, spend about 10 minutes with each patient, talking about all their concerns, seeing how they're getting on, making sure that they are following the expected or the desired treatment plan. After that, the consultant would usually go to a few more meetings, would attend seminars in the hospital, but most importantly, what I noticed was different from my experience anyway, between surgery and spending time with a physician, was that physicians often taught a lot more. Of course, surgeons still teach a lot to registrars and training surgeons, but with a physician, you had 3 or 4 first-year doctors, second-year doctors around the consultant, and the consultant was, often giving advice about how to take really good histories, but was also helping them to kind of realize what important things there are to look out for in histories that can help produce an accurate diagnosis and eventually an accurate treatment plan. I guess in hindsight that was kind of a bad thing to compare between surgery and a surgeon and a physician. Surgeons still do teach an incredible amount of stuff because they have many trainees, and it wasn't the best of comparisons I've made, but that's what I remembered from my experiences. Now this really contrasted with research and medical research, where often you have a group leader, which I was shadowing, who'd be conducting many different experiments in the laboratory. They'd always be attending meetings, they'd be attending seminars. Of course, patient contact in clinical research isn't as much, but I do remember the group leader that I was with would often go to the hospital, go to physicians and talk about cancer patients and kind of see, just discuss that to kind of allow her research to be translational. So it ensured that the research that was done, the scientific medical research, was research that could be transferred to clinical practice. So hopefully this sort of comparison that I've made, although it's not the best of comparisons, kind of gives you an idea of how you could end up comparing your different placements, and also could help you appreciate the different perspectives that you get from having different placements. Just to add lastly about accident and emergency was completely different. It was a lot more hectic and a lot more fast-paced than other placements I had. You had patients in minors, patients in majors, you had emergencies, you had less kind of life-threatening conditions, and as well as actually spending time with doctors, I was really lucky to spend time in the reception, and I saw how the receptionist also has a really important role actually in making sure the A&E runs properly. Because if the receptionist didn't tag patients properly, if the receptionist doesn't ensure patients know where they're going, what they need to do, then kind of the whole A&E falls apart. So just to conclude all of this quickly, in different departments, it is important that you not only shadow the doctors or surgeons, that you kind of talk to other people involved in the care of patients, whether that's nurses, whether that's the porters, whether that's the researchers, whether that's even the receptionists. As in, like, all roles in a hospital are important, right? Although you want to be a doctor, although you want to be a surgeon, although you want to be a researcher, hence you're going to medicine, it is extremely important that you appreciate the roles done by people who aren't, doctors, surgeons, or researchers. Because without them, the hospital will just not run efficiently. Everyone in the on the team has a different thing that they're contributing towards the effective healthcare of patients, and so it's important that you appreciate everything, and that in interviews you actually mention that you notice the importance of other people's roles. And what this shows the admissions tutor is that you've got a holistic idea of what medicine involves, and not just what the doctor or surgeon or researcher does. Volunteering is really important because, especially long-term volunteering is really important because it shows a commitment. It shows that you've regularly, committed to something, and that you've kept to it, and that you're persevering with that placement, and that, you're not just doing things for the sake of it. People who aren't really interested aren't going to spend a year or two at their local hospital or their local, care home helping people. Some people might consider it a waste of time, when actually volunteering is complete opposite to a waste of time. You gain so much from it by just, for example, in a care home. Initially, I was quite skeptical. I was like, right, I'm not too keen about care homes, but I'll go and see what it's about, and I might enjoy it. So I went in with an open mind. I applied to local care home. I got a placement, a volunteering placement, and that was probably one of the best things that I've done. I'd say it was more rewarding than any of my work experience placements. Even though I found surgery amazing, I'd say my volunteering was so much more beneficial to my understanding of what caring for people is like. One of the most memorable moments is when I was playing dominoes with one of the residents at the care home. Don't want to mention his name, but just small things will stick with you, because when you're in a care home, you actually talk to the residents, you hear about their life stories, you hear what they have to say, and I don't know, it's just spending time with people, especially when they're at an elderly age, and it's just really rewarding. So it's hard to kind of convey how how important volunteering is. All I recommend is go out and do it. Especially at a care home or a hospital, where you get to talk to people and where you get to hear their stories. It's one of the best things you'll do. I can guarantee that. So just to conclude, your work experience and your volunteering both give you experiences. They both give you things that you can talk about in your interview. Now, the important thing is, when you're answering questions at interview, or especially when you're trying to convey that you're not the typical medical applicant, they've got more to you. The best thing to use is your experiences to back up your points. So the more experiences and the wider variety of experiences you have, whatever question they ask you, you can always find something in your mind that you can link to their question. So as well as answering their question, you've brought in a direct, a direct bit of experience that you've got, and that will make your answers more personal and thus more memorable. And so when the interviewers are going through candidates, they're going to think back when they come across your profile. They'll think, this kid, he actually did a lot of stuff, but not only did he do a lot, he's actually learned a lot from it, and he's actually reflecting upon what he's done. And they're going to value that. Or from my experience, from people I've talked to, they'll value a person who reflects upon their experiences a lot more than someone who's just rattling out bog standard answers that you memorized from the the interview prep book or something. So to conclude, work experience and volunteering are absolutely crucial when you're applying for medicine. You want to get a variety of work experience, and you want to have a long-term volunteering placement. Now, if you have any more questions about how you can kind of include your work experience or volunteering into your personal statement, and how you can kind of reflect upon the things that you've done, do drop a comment below, and I'll be more than happy to help you guys out. Now that exams are over, I will try and upload weekly, and hopefully in the next few videos I'll kind of give you a sort of snapshot into what my first year at Cambridge has been like. But on top of that, I'll also make a few more videos about the medical application process to help you guys out as much as possible. So take care, and I'll see you in the next video.